Gabby, and today I'm going to be going over insulin glargine, which is also known as Lantus and Toujeo. It's a long-lasting insulin, and it typically takes anywhere between 60 to 70 minutes to kick into effect. It has no peak, and it'll last typically like 24 hours. It is a medication that's used to treat type 1 and type 2 diabetes. Some of the important things that we really need to watch out for before taking the medication is making sure that we're monitoring our glucose levels carefully and making sure that we're adjusting our dosing accordingly. Another really important thing to take into account is that this insulin cannot be mixed with any other type of medication or any other insulins in general. Medication should look clear and colorless before you use it, and if it looks any sort of like funky color, I just would probably call your pharmacy right away and request for a replacement, because it's not good to use if it does not look clear. And then another thing that you're going to want to make sure is that you're using a different needle and syringe every time that you inject yourself. Make sure that you're not sharing your needles, reusing them, because then you can transfer viruses such as HPV, HIV, or other infections that another person may have. So you want to make sure that you're taking your insulin at around the same time every day. And when you inject it, you're going to go for the subcutaneous tissue, which is also known as your fatty tissue. So some of the really common areas to do it is in the belly, or behind the arm in the fatty region. But if you are gonna go for the belly, you have to make sure that you're staying within 2 inches of the umbilicus, which is also known as the belly button, and just making sure that you are rotating sites. So if today I were to be giving myself an insulin injection on the left side of my belly, then tomorrow I'd wanna go ahead and switch that up to the right side. If you ever miss a dose of your insulin, just try to take it as soon as you remember. But if it's almost time, like say I waited a whole day and it's almost time for me the following day, then I'm just gonna go ahead and take it at like my normal time with the regular dose. Never double up on doses or try to make up for what you missed the day before. As far as storage goes, we're always gonna wanna make sure that we store our vials or our pins in the refrigerator, and then it will be tossed out after 28 days. And you always just want to communicate with your doctor, your physician, whoever it may be, to just include any other medications that you may be on that may interfere with your insulin. The most common adverse effect of insulin is hypoglycemia, which is just a fancy word for low blood sugar. Some of these signs and symptoms to watch out for include anxiety, pale or cool skin, headaches, nausea, hunger, or shakiness. And then the low blood sugar can also be caused by possibly skipping a meal, exercising too much, or if you're in a situation where you're just extremely stressed out. And if any of these occur, just make sure that you're taking something high in sugar, like a hard candy or orange juice if you happen to have some on you. Honey, sugar, whatever it is that we need to do to get that sugar back up. And this can be controlled with proper dose adjustment, which would happen with your PCP, your NP, whoever your primary care provider is would probably be able to make those adjustments for you. We went over the common adverse effect, which is low blood sugar. We're going to be going over when you need to call a provider. Itching or hives, swelling of your face, hands, mouth, or throat, chest tightness, pounding of your heart, any trouble breathing, loss of consciousness, fever, chills, or rapid weight gain. You need to call your doctor. And at the end of the day, you know your body the best. And if something feels off, you're always better safe than sorry. So we went over your common things that you may experience, but if you experience any of the other ones that we just went over, call your doctor right away.